Hello, how are you today? I'm here to introduce to you the latest in simple but highly effective technology to use for leg holding for arthroscopy and open procedures. As we all know, when you do an arthroscopy followed by an open procedure, or vice versa, when you do an open procedure followed by an arthroscopy, it's difficult to hold the leg in position with a leg holder and then have to remanipulate the leg afterwards. It makes it very difficult. Oftentimes there's a large thigh holder that has to be attached to the bed. You have to take that off, and then you've got to find a surface to put the leg on. So in an effort to try to solve that problem, this is a very simple and effective tool. It's a leg holder that involves somewhat of a tunnel type area where the thigh sits inside the foam. The leg and the thigh then sit up against this surface. There's a block here that's used as a surface for open procedures. And then as the patient's leg is in this device, you can remove this Velcro block, which allows you to then provide distraction for the leg over in this area, allowing you to place a basin or an arthroscopy drape in this region to catch water. This can then be replaced back into the area for the open procedures that need to be performed. So, when we think about this, the rationale for this is I do a fair amount of arthroscopy for my open ankle fractures. In addition, arthroscopy for procedures such as lateral ankle ligament reconstructions, medial ligament reconstructions. Sometimes we'll do subtalar arthroscopies in an open ankle procedure. So there's a number of situations in which we use open procedures followed by an arthroscopy or vice versa. The benefits of this is really the thigh holder section. This is the section that is used for the counter traction against the distraction device that you're going to be using on the distal ankle. So typically one of the difficulties that we face doing arthroscopy is too much pressure on the popliteal space. So one of the benefits of this is, number one, it's very soft foam. It has a dugout channel where basically the thigh can sit. That also allows the leg to be held, as it's held in a little bit of compression against here, to be held so it doesn't rotate as much into internal and external rotation. Typically, when I do an arthroscopy with a thigh holder, the leg invariably externally rotates a dramatic amount, and you're almost operating at a 45-degree angle to the outside, so that this channel that's underneath the foam allows the leg to compress into this area and hold the position better. In addition, this foam up on top and the rounded surface right here on this edge basically help to diminish the popliteal space pressure, which therefore decreases the venous outflow obstruction and decreases the need to use arthroscopy or to use a tourniquet during the arthroscopy procedure, and instead you can reserve that tourniquet time for the open procedure that you need it for. One of the other benefits of this arthroscopy holder is it's just simple. Rather than having to get a thigh holder, you have to find the correct connector for the side rail for the bed. You have to then position it correctly depending on the patient's leg length. Sometimes it's got to be up further. Sometimes it has to be tilted more. This really allows you to just basically place the patient on the bed. Once the patient is asleep or is anesthetized adequately, you just slide this right up under the leg. It takes about 20 seconds to be positioned, and you're done. So it's a very simple and effective way to decrease the amount of time that you have to spend setting up the patient in the operating room for an arthroscopy procedure. And in fact, you don't have to use this for just arthroscopies followed by open procedures. If you just take this block out, you can use it for your regular arthroscopy procedures. It can be used for just a routine leg holder for any arthroscopy procedure that you wish to use without the block in its place. It then allows the leg to hang over this area. You provide distraction through your external distraction device, and you can use this for any arthroscopy procedure that you perform.